a normal occlusion and what is a malocclusion? So these are the definitions, but the essence we need to understand what is a normal occlusion. Normal occlusion is not a perfect occlusion. The perfect occlusion is the ideal occlusion, which never exists in the world, okay? Normal occlusion include variations in the tooth position and relationships. There is some minor deviations, but it is aesthetically acceptable and functionally stable. So there is no need for the treatment, which we always have to keep in mind when we ask patients to go for the orthodontic treatment. That if there is any need, and here you understand that why we are going to discuss so much our time of index of orthodontic treatment need, because we need to understand whether it's normal or it's abnormal. So normal occlusion frequently occur in the population, whereas ideal occlusion is completely rare. Then what is a malocclusion? Malocclusion is not a disease, but it is a variation of a normal morphology. So we should not treat patients that they come with some anomalies or they are abnormal. So because there are a lot of people, they are suffering from crowding and other trauma, but for them, it is completely okay. They don't find it to be treated, and such patients, you can inform them, but the motivation factor is the main reason why we treat the patient or not, because we need to understand in our philosophy that it is variation, but it is not anything which is anomaly. Treatment need is completely a personal choice, and it usually influenced and is usually influenced by social and ethnic background. Malocclusion can be defined as irregularity of the teeth, either within the same jaw or in relationship between the two jaws. Beyond that is accepted in the range. So what are the problems we are getting and why we want it to be treated? So the reason why we want to be treated is something which is not appropriate, aesthetically acceptable for the patient, then we need a treatment of that malocclusion. If it's compromising the health of the patient, like periodontal disease due to crowding, bone loss due to malpositions, there is a speech dysfunction, muscle imbalance, or there is some functional disorder that we need to be corrected, like TMJ, then we need a treatment, or it could be either of the factors in combination. Ideal occlusion is completely, we said, is in the ideal world, it never exists. And according to the angle, it is that mesiobuccal cusp of the maxilla should sit in the buccal groove of the lower first molar. And this is a perfect arrangement of the molars. And then the teeth are arranged in the line of occlusion, which is a line passing through. We will discuss is how we describe the line of occlusion, and teeth are arranged in the line of occlusion, then it is ideal occlusion. So there is no crowding, there is a tight contact, the inclination of the teeth are perfect, and there is a class 1 occlusion. Also, the ideal occlusion should have a maxilla and mandible in a correct size skeletally. There is a coincident midlines. There is no discrepancy in CO and CR. You know what is CO and CR? CO is called as centric occlusion, and CR is centric relation. When we ask patient to bite, it is called CO position. And when we ask patient to open a mouth a little, where the mandible in the rest position is called as CR position. The midline in both of CO and CR should be coincident, okay? There should be no deviation in centric occlusion. And that's called, there is no functional abnormality. The canine relations, there is a group occlusion or the canine guidance, and there is an incisor guidance, that incisor relationship is perfect. That makes ideal occlusion. How often we see this ideal occlusion? Very rare. Even people have a perfect teeth, they not have an ideal occlusion. So Also, the Andrew is, you are very well with these Andrew's keys of normal occlusion. It also defined the same things what we have described earlier in 6 points, that if you want a normal ideal occlusion, we need 6 keys to be fulfilled. Now, these keys are very important to understand, because when we finish the case, we are looking for the ideal occlusion, and we want all need to be achieved. And this, by looking at all these things, we can mark ourselves or rank ourselves that what we have able to achieve and where we need to work more. So there should be a class 1 molar relationship. There is a correct angulation of the crown, correct inclination of the crown. There should be no rotation, no spaces, tight contact, and the flat occlusal curve of SB. In prosthetics, when we make a complete denture, we usually incorporate the curve of SB. And why we incorporate that curve of SB? Because the prosthetics get more stable when there is a curve of SB. But when we come to the dentition, normal dentition with the teeth, in our TMJ is designed in a way that we don't need any curve of SB. It works better with a flat occlusal plane. So we correct any curve of SB already present. And now in literature, you have seen after the 6 keys of occlusion, there is a 7th key of occlusion have been introduced in 2016 in literature, which is Bolton ratio. So what is a Bolton ratio? Is a discrepancy in the size of the upper teeth and the lower teeth. So any proportional discrepancy in the size of the teeth will disturb the occlusion and interdigitation at the finishing. So if there is no Bolton discrepancy, you get a very good occlusion at the end of your case. But if there is any Bolton discrepancy and you have not adjusted during the treatment, in interproximal stripping or by doing other mechanics, then you end up having not a perfect interdigitation or perfect occlusion. So in 2016, research shows that apart from the 6 keys of occlusion, we need to achieve the 7th key of occlusion, which is a perfect Bolton ratio. Are we okay so far? Okay. Now we come into the secular trends in the malocclusion prevalence. So we know that the malocclusion varies in different parts of the world. So if you are in Africa, you see a different type of cases. If you are in China, you see a different part of cases. If you are in the Asian population, Indian, you get a different type of cases. Now, the malocclusion are also different in different ethnic populations, okay? Like Negroes, they have different cases and different races, right? So bimaxillary protrusion is more common in the Negroes. Class 3 is more common in the Japanese, Danger Island people. Class 2 is more common in whites. Class 3 is more common in blacks, okay? There is more malocclusion in the white people in comparison to the black in general. In black people, we see more straight teeth, but when you go in US, you find that there is more crowding. We can see more malocclusion in the urban population than the rural population. So if you see class 2 malocclusion incidence, it's 31% in the Danish, 8% in the African population, like South Africa, 11% in Kenya, 16% in Saudi Arabia, like Asians, and 20% in white people. So coming to the Nairobi population, which is very important because we live in Kenya, we need to know that what is the prevalence of malocclusion in Nairobi, which is 72%. So if we say that 72% of the kids may have malocclusion, it means that there is very high demand for the orthodontics, okay? It's a big number, 72%. And the study has been done between 13 to 15 years of the kids going to the school. Around 19 students have been assessed, and they saw that 93% of the 72% are all class 1. So it is a very good news that all class 1 cases can be treated by general dentists if they know the basic principles. So 93% of the cases have been class 1, 19% suffering crowding, 19% rotations, 10% posterior crossbite, 10% increased overjet, and 8% open bite. So treating open bite is a little bit more difficult. Okay, treating overjet is more difficult. Treating crossbite is a little difficult, but treating class 1 with crowding and rotation are the common cases which can be treated by general dentists with the basic knowledge and principles.